Dr. Akinkunmi, Ilori, Group Head Medical Operations for Bastion HMO. Nice to have you in the building, Dr. Akinkunmi. Good morning.
Good morning. Happy to be here.
Happy New Year to you.
You too.
All right then. So we've tracked this road before, Dr. Akinkunmi, armed with nothing else other than the zeal to empower Nigerians with the tool of knowledge about health insurance. So how are we performing with health insurance in Nigeria?
Yes, I mean, the health insurance fair nationwide has been impressive, although we still have a long way to go, but I mean, we've come leaps and bounds over the last few years. In the last decade or so, it's been said that only a handful of Nigerians actually have access to health insurance. Just about 3% of people aged between 18 and 49 actually have access, but I think that number has grown significantly in the last decade or so, and so we are seeing a lot more people embracing.
People are tapping into it right now.
Exactly. The enlightenment is better, the awareness is better, and people are seeing the need to actually have health insurance cover their health needs.
So let's break it down for our listeners. So what is health insurance?
Yeah, so health insurance basically is, I can say it's a contract, between an individual or a group of people and the insurer. The insurer in this case is the Health Maintenance Organization, HMO, of which Bastion Health is one of the major HMOs in the country, whereby they pay a premium. So the money they pay for them to be able to have access to affordable healthcare is called a premium. They pay that premium to buy a policy, and then the HMO is able to take care of, the medical needs, because they partner with the hospitals, the healthcare providers. So these enrollees that we call them, so people that purchase healthcare plans are called enrollees. Right. They can go to the hospital without having to incur any cost or very little cost, and then not just for them but also for their families as well.
So why is health insurance important?
It's very important because it takes off that financial burden. We understand that today in Nigeria we still have a lot of people, especially in the remote areas, that earn less than $1 a day. And health care, of course, we know is very expensive. And it's important that people are able to save money. People have other needs. They need to eat, they need to go out, and things like that. So it's important that they spend as little as possible in taking care of their health. Health can be unpredictable. Illness can be unpredictable. Anything can happen at any time.
Right.
So it's important that you are prepared for that, and being able to get health insurance at the right time will give you that right preparation.
All right. So when we look at the health insurance value chain in Nigeria, where can we situate Bastion Health?
Yeah, Bastion Health is actually a nationwide HMO. So we are present in all the major regions, of the country. And it's a HMO that started about 3.5 years ago, thereabout in 2021. And we've been significantly getting better, leaps and bounds. We are in all the regions, and at present we have over 2,400 healthcare providers that we partner with.
All right.
We partner with large organizations, SME organizations, as well as individuals and families as a whole.
Right. So there is a regulator for this sector, right?
Yes, there
and
is.
You guys as HMOs or the health maintenance agencies plug into this to serve the people under that regulator. Is that correct?
Yes, it's very important that we mention the regulator here, which is National Health Insurance Authority. This used to be the National Health Insurance Scheme, but in 2022, under the presidency of Buhari, we had the change from National Health Insurance Schemes to National Health Insurance Authority, and they made it mandatory. There's a National Health Insurance Act that made it mandatory that every citizen and every legal resident of Nigeria must have some form of health insurance.
So it is mandatory?
Yes, it is mandatory.
And yet we still have less than 10% of people.
Exactly. So that's why I said it's been something that has been stalling for a while, but in the last few years it has actually increased, because the government too have their own form of health insurance, which is social health insurance. So but the HMOs are just supporting the government and being able to provide a much more robust.
All right. So we have so many HMOs. Is that correct?
Yes, we do.
All right. So let's now situate your own HMO, which is Bastion Health. How unique, or perhaps what are you bringing to the table that is different from others?
Yes, of course. Not to blow our own trumpets, but I mean, Bastion Health has focuses on convenience and flexibility, and of course, we have a very robust technology platform, which is our major selling point. You know, we have the Bastion HMO app, where a lot of things are going on there. You can actually speak to a doctor without even going to the hospital. You know, with all the challenges experienced by people when they go to the hospital, the long waiting times, people spending 2-3 hours in the hospital just to see a doctor, you know, not being able to get their medications on time and things like that. So through that robust technology platform, you can even speak to a doctor. You can even get your medications after you get a diagnosis from the doctor to be delivered to your workplace or even to your house.
You mean it?
Yes, exactly.
Wow. That sounds too good to be true.
It's very much true. It's very much true, and that is what has made us stand out, you know, from the crowd in this HMO space. You know, even in terms of people going to the hospital, we're able to pre-book appointments. You know, so you don't go to the hospital and just be waiting. You don't know what to do. You know, you go on the app, you can book an appointment, and then we from our end will be able to reach out to the hospital and say that, you know, this person needs to see a particular specialist tomorrow, for instance. And then you get there and you don't have much waiting time. In terms of medications as well, you know, that's also a major complaint from many people. Release that they go to the hospital, they give them substandard drugs. I said I want this one, they gave me this one, and then people think that they give preference to cash paying customers.
Nope, that was the idea.
Yes, because they say cash is king, right?
Right.
But we have that relationship with the hospitals whereby we let them see that people under Bastion HMO are not second-class citizens.
Okay,
you know.
Let's talk about those things that can be covered. But before then, quickly, let's reflect through the health insurance plans that are available under Bastion Health.
Yes, so as I said, we cater to different array groups of individuals.
All right.
Large corporate organization, you know, the banks, the oil companies. We also have the small retail companies as well, people who just have 10, 20 people in their company. And of course, most importantly, and that is what we are really driving to in 2025, individuals, especially people, you know, who are not so much financially blessed to be able to afford the higher plans. I mean, with as little as 25,000 naira, you can actually have access to a plan. I'm not talking about monthly here. I'm talking about annually payment.
25,000.
25,000 naira.
What does that cover, please? Let's know.
You can go to the hospital. You can see a specialist. You can do your antenatal. You can give birth. You know, you can have a surgery. So it covers a lot. I mean, the amount that you are paying is just very negligible, just a fraction of what you would normally pay if you had to go to the hospital.
If a lady is to do CS in the hospital, will it cover that?
Yes, it will be covered.
You mean it?
I can assure you that 100%.
Okay. Like I said, it sounded too good to be true. But which hospitals fall under your HMO?
We have hospitals all over the country. You know, as I said, over 2,400 hospitals are available. But hospitals have different plans. Of course, you expect that hospitals are not going to operate the same tariff. You know, they are not in the same location. So prices of medications, prices of services, procedures differ from hospital to hospital. So we have different cadres of hospital. But rest assured that because you are going to a hospital in a particular location, that the quality of that hospital is not as good as one in a highbrow location. We do what we call quality assurance checks and hospital inspections to say that no matter the hospital you go to, you will be served very, very well. There are doctors on ground to take care of you. There are pharmacists there. There are lab attendants to, you know, give you the necessary services you need to be catered with.
All right. This one says, good morning, Victor. How affordable is health insurance for the average Nigerian? Smith is sending that one in. So maybe I want to ask Smith's question. I'm going to pose it to you once again. So how affordable is it?
It is affordable. Just as I alluded to, you know, as low as 25,000 naira annually, you can get a plan. We understand that even going to the hospital on one visit and you paying out of pocket, you can spend and overshoot that 25,000 naira. You know, even treating malaria alone can cost you more than 30,000 naira these days.
Right.
So it's important that we understand the kind of financial security and the peace of mind that buying a health insurance plan will actually bring to you.
All right. This one says, good morning, Traffic Radio. Are pre-existing conditions covered under health insurance plans in Nigeria? Thanks.
Definitely.
Ifeanyi sending that one in from our God. Thank you so much. So are they covered?
Definitely. We know that that's one of the major burdens we have in this part of the world, in Africa as a whole. Illnesses like hypertension, diabetes, arthritis. And yes, these are covered under the HMO plan, 100%.
Now, do HMOs choose what they want to cover, or is it supposed to be the same for, is that the rule from the regulator to say, look, you must cover this, you must cover that, or do you choose what you cover?
So there are certain national standards and even worldwide standards on what HMO covers. There are certain things, of course, that the HMO will not cover. Even all over the world, we talk about things like cosmetic surgeries. Of course, that will not be covered. Someone wants to, also have some sort of implant or things like that, it will definitely not be covered. But we understand the terrain that we walk in. We understand the needs of the people, and that is what we try to cater to. Even in terms of customization, someone comes to us and says they want a particular plan for their family, they want a particular plan for their staff. They have more females on their staff and people within the reproductive age group. We know that things like gynecological care is something that will be important to them. So we can actually customize plans to cater to their very needs so that they will find value in the HMO. People say sometimes that I didn't use this thing though. I paid money, I didn't use it for a whole year. And they are giving me this. I don't need it. So we try to cater to your needs. And it's also important to state here that it's not just to go to the hospital to get treatment. Preventive health is also a big part of healthcare.
So do you guys do that?
Yes, we do that. So
how do you do that?
Yes, so we have wellness checks. Everybody is supposed to go for their wellness check annually. Where you go to the hospital or diagnostic center and they check your blood pressure, your cholesterol, blood sugar and things like that.
That's also covered under your HMO.
Yes, and we even go one step further we can bring the health check even to you, to your company.
This is news to the ears.
It is to some people, but of course we've been doing this for the past 1 or 2 years now, so we can actually go to your offices, to your company, to actually carry out a routine health check. We understand people are busy. Some people leave their houses as early as 4:30 a.m. and not to come back late at night.
Dr. Akinkunmi, I'm going to hold you on there. This one says, amazing morning, please sir, how does someone go about choosing the right HMO for their needs? Mrs. Kashim. Okay, Kashim. Mrs. Kashim, thank you so much. So, what are the criteria for one to choose any HMO?
So there really is no criteria. It's a matter of choice. Our pedigree speaks for us.
Can one switch?
From HMO to HMO, or the plans?
No, HMO to HMO.
Of course, it's your choice, as I said. We can't hold anybody down to choose HMO. But as I've alluded to, our pedigree speaks for us.
Can I have 2 HMOs at the same time?
If you choose to, we have people, couples who the husband is working in company A and has a HMO under him, and the wife is working in company B and has another HMO. So they both have access to each other's HMO because most HMOs will cover the family. So of course you can have 2 HMOs at the same time and choose to use the one that provides the better service at any point in time.
This one says, what are the key differences between private and government-backed HMOs? Between private and government-backed health insurance schemes. Yes. I don't know what he's talking about.
Yes, I totally understand. So as I said earlier, the government also has their social health insurance. In Lagos State, we have the LASHMA, where they are trying to ensure that everybody has access to health insurance. And the major function of the NHIA is to promote and integrate, healthcare insurance. So that integration part, they know that they cannot do it alone. The government cannot do it alone. They need help, of course, from private organizations as well. So the integration part is to try to, collaborate and bring the government HMO and the private sector HMO together. And usually the private HMOs are usually a bit more robust in terms of hospital access and services rendered.
All right, then this one says, good morning. I am Usman from Mile 12. Please, doctor, why do some hospitals reject HMO patients, and how can this be addressed? Usman, thank you so much for that.
Yeah, that question is a very, very good question. So I said earlier that It's the general consensus is that hospitals prefer cash-paying patients because cash is king. So it's important that the relationship that the HMOs have with the hospitals is top-notch. It's knowing that the HMOs patients are not second-class citizens. You don't have to go there. Don't just toss them to the side and say, you go and sit down over there while let's treat the person that brought Ghana must go back to, to access care. So it's the perception, that has to change, and it has been changing over the last few years. And that's okay. These people are actually part of a group, part of a team that actually knows what they're doing.
Let's round this off right now. So what's your parting thought, and where's your office located, by the way? Bastion Health?
Yes, Bastion Health, I said we located nationwide in the 6 geopolitical zones. So we have offices in Lagos. Our 2 offices in Lagos are in Victoria Island and also in Yaba. The headquarters in Victoria Island at Deku.
Okay.
And then we have offices in Ibadan, Abuja, Kaduna, Enugu, Port Harcourt as well. So you can access us on the website www.bastionhmo.com. That's our website, and you can actually buy a plan on the website. As I said, you can also reach out to us on the Bastion app, and of course our numbers is 0800 Bastion as well. So you can also reach out to us on our 24/7 customer care lines. And before I go, I'm sorry, I just have to chip this in that Bastion HMO is also doing a Valentine special.
You mean it?
So all the lovebirds in the house,
they can go around.
So they can go to Bastion HMO on Instagram. That's at Bastion HMO. Follow us on Instagram at Bastion HMO. If you buy a plan, 100,000 naira plan and above, you are able to have access to a very wonderful session. We're going to pick 2 couples in a raffle draw.
Wow.
You also have a wonderful session, with your loved one at a nice spa here in Lagos and other parts of the country as well.
That'll be good. All right, then, Dr. Akinkunmi, it's nice having you in the building. Thank you so much for being
here.
All right, he did say you can call on them. That's 0800 Bastion, and that's 0800 2278 466. All right, then we'll leave it at that for now. We have to go. Thank you so much. We'll be switching gears to celebrate you on our birthday profile, and that'll be after this short break.
Nice. I take it one.